And after I get done, then some of our vendors are gonna get up and take a couple of minutes to explain some of the supplemental plans that the county offers. So, we're gonna go over the county health insurance plan. I'm gonna highlight some of the differences of the two plans. And we're also gonna go over some ways that you can save on your healthcare costs. And also during the course of the presentation, I am going to go to that website to show y'all how easy it is to log on and pull up your claims information. And also, if you are on the health risk assessment account, see what is left in your fund. So the other day, in court, I heard the county judge make a comment, so we do not have Aetna insurance, or he said something to that effect. And I think that that is something that a lot of us just don't know, is that Aetna administers our plan, and we do use the Aetna in-network doctors, and they also have some other services that they do provide for us. But when it comes down to who pays for what, outside of the cost you spend on your health care, the county funds our health insurance. So for example, let's say you go to a doctor and it's a regular general physician, and you pay, and you're on the buy-up plan, and you pay your $40 copay. As long as it's an in-network doctor, they have talked with Aetna already in the past, and they have agreed upon what's called an Aetna member rate. So your part of that bill is $40 on the buy-up plan, and the rest of the bill might be about $58. And that could vary depending on who your doctor is and what the Aetna agreed upon rate is. So you do pay a copay, the county covers the rest of the cost. Another example of that, for those of you who are on the buy-up plan, let's say that you go and you buy, or you have to pick up a prescription, and it's a generic and it costs you $5. Anything past that $5, the county is covering the cost of that prescription. For those of us who are on the health reimbursement account, the money that we utilize to cover our healthcare costs for medical and pharmacy claims, up to the first $1,000 for individual coverage, that is funded by the county. And if you cover more than one person on the health reimbursement account fund, then you have $2,000 in this fund, and that is also funded by the county. So we just wanted to be sure that everybody was aware of that. So we do have two plans to choose from, and one of them is the health reimbursement account, and the other one is the buy-up plan. Things that they have in common: they use the same network of doctors. You don't get better services using one plan over another. Also, your dental and vision benefits work the same. Whether you're on the HRA plan or the buy-up plan, you go to a dentist's office, you're going to pay for it the same way. And the out-of-network deductible is also the same for both plans. And I believe that the out-of-network deductible is $3,000. Once you have met the out-of-network deductible of $3,000, you are then responsible for 50% of the cost. The county covers the other 50% for out-of-network. So everybody, you should have received a handout which has the rates attached to it, and then an explanation of the HRA plan and an explanation of the buy-up plan. We're going to first go over the HRA plan. So how an HRA plan works is $1,000. If you just cover yourself, $1,000 is deposited into this fund, and whenever you go to your doctor's office, you provide them with your insurance card. They run the card through the insurance system with Aetna, and the cost of that doctor's visit is deducted from the $1,000 fund. And then if you cover more than one person, then it's $2,000. So every time you go to the doctor, every time you pick up a prescription, it is deducted from the fund. The thing about using the Aetna in-network doctors is that it's going to be cheaper than using an out-of-network doctor. Change to the HRA plan this year is that the in-network deductible went up from $2,500 to $2,750, and also the maximum out-of-pocket increased $5,000. So, everything that you do, as far as medical visits and picking up your pharmaceuticals under the HRA plan, applies towards your deductible. So for an individual, your deductible is $2,750. $1,000 of that is coming from your health fund. And every time you go to the doctor, every time you pick up a prescription, you're reducing your deductible. So really, your deductible for in-network care under the HRA plan is $1,750. That's the same deductible that there will be for the buy-up plan this year. Does anybody have any questions about how the HRA plan works? Okay. So some highlights for this plan. First of all, you can roll over any unused funds. I started using this plan October 1st of 2015. So the county deposited $2,000 into an Aetna fund for me. And on September 30th of 2016, I had $500 left over. So that $500 rolled over, and I started our current plan year with $2,500 to go towards mine and my $2 medical expenses. And I'm going to show y'all here in a little bit. I'm going to show y'all this insurance worksheet that we came up with for you to utilize to see which plan would work best for you. And I'm going to use my family as an example to show y'all what our doctor's visits cost us and what the prescriptions cost us. So another highlight of this plan is that there are no copays associated with it. So whenever you go to a doctor's visit and it's in-network, you're going to pay an Aetna member care rate, but you're not going to pay a copay. Basically, you're paying the full cost of that doctor's visit. Whenever you go pick up a prescription, you're not going to pay a copay. You're going to pay the Aetna member rate for that medication. And again, dental and vision claims are not taken out of your health fund. That is totally separate. Okay, so the buy-up plan. This is the plan where the premiums each month are a little higher, and you pay a copay whenever you go to doctor's visits and pick up your prescriptions. So this year, the in-network individual deductible is $1,750, and the family in-network deductible is $5,250. If you just cover one other person on your plan, so let's say you just cover one child or you just cover a spouse, I almost said one spouse, but just your spouse, then it's just $1,750 each. So it's not going to be $5,250. It's $1,750 each. And then the in-network individual out-of-pocket maximum for medical care is $3,500. And I know that y'all see another maximum out-of-pocket up there, that's $7,150. That out-of-pocket includes the $3,500, but here's the difference between the two. Every time you go to a doctor's visit, or every time you pick up a prescription, it is going to reduce your maximum out-of-pocket of $3,500. If you have some sort of major medical event that you have to take care of, so you have an MRI, you have an X-ray outside of your normal doctor's office visit, you take an ambulance ride, you have an overnight hospital stay, a major surgery, things of that nature, that will reduce your $3,500 maximum out-of-pocket for in-network care. That also reduces your deductible, your in-network deductible. So let's say you've had one of these major medical events happen and you hit your $3,500 maximum out-of-pocket. Any other major medical event for in-network care is then covered at 100% by the county. However, doctor visit copays and prescriptions will still have a copay attached to them until you've reached the $71.50 maximum out of pocket. All of that will always go towards the $3,500. But once you've reached the $3,500, any major medical event, MRI, surgery, hospital stay, for in-network care is covered at 100%. And then after that, you're only paying your copays for your doctor's visits and your medications.
So if that facility is not in the network, and it's out of the network, and they don't do business with Aetna, how is my money spent?
So if it's an out-of-network doctor, out-of-network facility, you meet a $3,000 deductible, and then you cover 50% of the cost. So let's say that you have some sort of event, you use a facility and it's $20,000 just for the facility. It's out-of-network. You pay $3,000 because you have to meet your deductible, and that leaves $17,000. You then pay half of the $17,000, and the county pays the other half of the $17,000.
But if it were in network, I would
If
pay.
if it were in network, then the most that you would pay for the doctor for that facility is $3,500. But then let's say, because you had this major event happen, you then have to have some follow-up visits with your doctor. You will pay a copay for those follow-up visits. You will pay the copays for your medication up to the $7,150. And that is an individual only amount. Any other questions on how those maximum out-of-pockets work? If you think that you're kind of getting it now, but you realize later that you do still have questions over it, please call HR. In the benefits guide on the emails that I sent out last week, I have all of our phone numbers and all of our email addresses. Please don't hesitate to contact us, because we want you to understand how these plans work so that you can pick the plan that best suits your needs. And we can definitely help you figure that out if you would like for us to help with that.
I have a question.
Yes, ma'am.
What if you're also insured through your husband's company and their deductibles are less?
So the question is, what happens if you're also insured through your husband's company and their deductibles are less? Your employer is your primary insurance carrier. So your deductible would be applied first, and then depending upon how their plan works, will determine what you would pay towards that insurance. Yes. Did everybody hear the question? Okay. Any other questions?
Yeah. All right, so what if I'm covering me, my wife, and my child, and let's say we have a family deductible of $5,250? Is that $1,750 per category, or can I take, like, me personally, let's say I go to the hospital, I may be personally responsible for the $5,250, or is it just at $1,750?
Okay, so the question is, if I cover myself, a spouse, and a child, and I see that family deductible of $5,250, and something just happens to me, and I go to the hospital, am I responsible for the full $5,250? And the answer is no. Each individual has their own deductible to meet of $1,750, and not one individual will pay more than $1,750 for in-network care.
Is that same apply to the out-of-pocket max as well, and the federal out-of-pocket max? Does it divide it that way as well?
On the first out-of-pocket maximum, yes, each person has the $3,500 maximum out-of-pocket to meet, and then on the family federal OOP, the max is $14,300 for a family.
Right, so I mean, that's divided as well, is what I mean. Like,
Well, one person can meet $71.50, and then the rest is divided between the two. Yes. Good question. Okay, any other questions? I'm not done, I'm still gonna go over it a little bit more. Okay, so in the packet of information that you received, you should have also received a copy of this. And what this shows is what goes towards, and this is for the buy-up plan only. So what goes towards the deductible, what goes towards the individual maximum out of pocket, and what goes towards what's called the individual federal maximum out of pocket. So under the deductible, on the buy-up plan, what goes towards that are MRIs, X-rays, CT scans, in-network ambulance services, major surgeries, things of that nature. On the buy-up plan, whenever you go to a doctor and pay a copay, whenever you go pick up a prescription and pay a copay, that does not go towards your deductible. That does go towards your maximum out of pocket, but not towards your deductible. So what's going towards the maximum out of pocket are all those medical events, plus all the copays that you pay. And then once you hit the 3,500, and you have another major medical event that happens, and it's in network care, then it's covered at 100% by the county, other than your follow-up doctors, or any doctor's visits after that, and any prescriptions that you might have to get, then you're paying for the copays up to the $7,150. And the $7,150 includes the 3,500, it's not in addition to the 3,500. So essentially, once you meet the $3,500 maximum out of pocket, you then have $3,650 left in copays that you could potentially pay for the plan year. Okay, I wanted to show y'all the Aetna website, and down below, those are screenshots of my phone. I have the Aetna app, and whenever you first pull it up and log in, you'll see the Find Care, and then, you know, as you continue to swipe to the left, you have different options that you can utilize to look at your claims and things of that nature. I've actually used this app quite a few times. My family was in South Carolina last year, and somebody got sick, and we needed an urgent care. So I got on the Aetna app, and I found an urgent care, which was within about 5 minutes from where we were staying, and it was in network. And then the very next month, my family was in Florida, and one of my daughters got sick, and we needed to find an urgent care for her, and we found an urgent care within about 2 blocks from where they were staying, and it was in network. So the Aetna app can definitely be utilized and help save you time and possibly some money too. So I'm going to click on the Aetna website here. But you see in the left-hand side here, the stethoscope icon. If you click on that, then you can find care. You can find urgent cares, you can find doctors, so on and so forth. If you click on manage claims, if you're on the HRA plan, and you click on medical balance in the top or in the mid right-hand section, then it shows you what remainder you have left in your health fund account. Kristen has used hers this year, and she is now paying out of pocket. How long have you been paying out of pocket now?
Just the beginning of August.
So just the beginning of August, she started paying out of pocket. So she didn't pay any more premiums all year long. If she would have been on the buy-up plan, she would have paid $70 a month towards premiums. But starting in August, she's just now depleted her fund and just now paying for her healthcare costs. So I just wanted to show y'all, you know, the highlights of the Aetna website. Whenever you do decide to look to see which plan is better for you, what you need to do is to log on to the Aetna website or download the app and look at your claims. And whenever you pull up your claims, you'll see where it says the Aetna member rate, and then it'll say your costs. So on the HRA plan, the Aetna member rate is the amount that you would pay for the cost of that visit or the cost of that medication that you picked up from the pharmacy. Where it says your cost, if you're on the buy-up plan, then it might say $40 or $60 for medical visits. Those are your co-pays. And it's really good to look at that information, pull a year, pull the past 2 years to see what is your typical year look like. What are your typical claims? The reason why you want to do that is so you can see which plan works best for you. And we have something called the insurance worksheet And what I'm going to show you is what happened this previous year for myself and my daughters. You can see there were a lot of pediatrician visits that we had, and then we had 3 urgent care visits back to back in January and February. A couple of double ear infections and a strep throat. So what I did was I pulled all of our claims for the previous year, and I found the Aetna member rate. And I know that that Aetna member rate is what we paid under the HRA plan. And then I plugged into the column where it says buy-a copay, what our copays would have been at those doctor's visits and for those urgent care visits. So for regular doctor's office visits, on the buy-up plan, your copay is $40. And to go to urgent care on the buy-up plan, it's $50. So I've then totaled those visits, this line right here. So under the HRA plan, it was a total of $1,008 and some change, and under the buy-up plan, it would have been $330. That's a huge difference. And don't think yet that I was crazy for being on the HRA plan. I'm going to show you how it worked for me. So I have a section on here for any specialist visits. We haven't had any yet this year. And then also some medications that we picked up for the year. So again, I looked at the Aetna member rate. So this is what we truly paid on the HRA plan for the medications. You see this one here that says 104 and some change. That was a 3rd tier drug. So on the buy-up plan, it would have cost $60. So then I totaled the cost of those drugs. Where it says the 171, that's what we paid under the HRA plan, or what was taken out of the fund under the HRA plan. And then this 88.96, this is what I would have paid total for the year for our medications had we been on the buy-up plan. So then what we did, or what I did was, I wanted to find out what was left in my HRA money. So between the medical visits and our prescriptions for this year, not including what I wrote over from the previous year, but $819 and some change has been taken out of the health fund. I haven't spent anything out of pocket for our medical visits and for our prescriptions. I looked at what the medical premiums will be for the year for employee children under the HRA plan and also under the buy-up plan. Under the HRA plan, the total amount is $2,448. So that's it. That's what had the rates that are becoming effective October 1st. That's what I would pay if I had the claims that I had this year. Total for the year. If we were on the buy-up plan, $4,070 essentially is what we would pay total for the year. The premiums are higher on that plan, and that includes what we would pay for prescription copays and what we would pay for medical visits. I just wanted to show y'all what a typical year was for my family and how the HRA plan worked for my family.
Does that include the monthly fee for the buyer as well?
Yes, yes, that's in here as well. The monthly fee turns out to be, for the year, is $3,651, I believe, for children, for employee children on the buy-up plan. So whenever you do this for yourself, be sure to pick the right amount from this column here, under the buy-up and under the HRA plan. I'm a big picture kind of person. I want to see what I'm going to pay for the entire year for my health care costs. So as it stands right now, we have close to $1,400 left until September 30th, that as long as nothing else happens, then we're going to roll that amount over, and that will be added to the $2,000 health fund money that the county will deposit for my family coverage. So we'll start the year with over $3,000 for health care costs. Yes, ma'am.
So once you go over that 2,000 though, you're responsible for everything out of pocket, or?
you're responsible for your cost up to your deductible, and you're responsible for your maximum out of pocket. And once you hit your deductible, you then pay 20% under the HRA plan, or the buy-up plan too. Once you hit your deductible, you then pay 20% of the costs up to the maximum out of pocket. So under the HRA plan, the maximum out of pocket for an individual is $5,000. So for you and one other person, it's $10,000 each would hit the 5,000, and then for a family, it's 15. But if you just cover yourself and your maximum out of pocket is 5,000, 1,000 of that comes from the health fund. Yes. Okay. Any questions about this sheet? Kristen, do you want to come show yours?
Yeah, I can talk about it real quick, because it's
Okay.
a quick scenario. Of course, you saw my balance that I had up there that I depleted for the year, but I will tell you that I had an unusual event. I had to do a sleep study, okay? Well, my doctor made arrangements, and I did a sleep study at home, which ended up being covered 100% by our plan, but I also had to purchase the equipment, okay? So the mask, the tubing, the machine. I would have had to pay close to $400 out of pocket versus my plan paid for that deductible, okay? And I'm charged for 10 months worth of rental of the machine, $55.86 per month. Well, my plan covered everything up until this month, other than $13, but I have like $44 plus whatever my rental fee will be for the month of September. That's all I'm out of pocket other than my prescription drugs, okay? So far, I've just been out of pocket about $190 versus if I would have gone the way of, if you look right here, if I had picked the buy-up plan with the premiums and the co-pays and everything, I would have looked at paying out of pocket $2,261, where all I'm out is $194. I do the 90-day prescriptions. That is where you get 3 months supply for the price of 2. It saves you money, it saves the plan money. So that's something to think about, no matter what plan you're on, okay? On the buy-up or the HRA, that does save you money. So that even though I depleted the money, it still has served me well, and I will continue on with this plan. Does anybody have any questions? Yes.
So if you know that you've got to have an ultrasound, say, is it better to go with the buy-up versus, or, you know?
Well, it just depends. With the HRA, it does create a little bit more homework for you, but you have the ability to get onto the Aetna.com, and you can even price out if you know you have to have it. Because you want to make sure you're in network, first of all, and find out where the doctor's facilities, because sometimes they have multiple facilities they can send you to, and find out where they're priced at. If you know it's something that you're going to do for the next year, and you know right now, you can kind of figure out, do I fit within whether you're doing $1,000, if you get $2,000 for yourself and one other dependent. You do need to determine, is that going to fit? Maybe I can do flexible spending, which is money you can put aside, basically tax deferred, into a debit card. You get that money up front, but you pay it out over the plan year, 24 pay periods, okay? That can complement a person that may be on the HRA and help them keep their costs down, because you're just paying it out like a payment plan through payroll deduction. But if you would like, a lot of those circumstances, we really can't say yes or no, but we can sit down with you and we can look at some things and figure out, is that gonna be the best bet? Okay, because we have until September the 8th to make a decision on any of these changes that you're making. So please let us know if we need to sit down with you and help you. Okay, we'd be happy to.
The cost estimator tool in Aetna, basically you just put
put a procedure in there, it'll tell you all the local providers and what they charge. So if you do that now, you can copy into this and put into this scenario.
Thank you.
Okay, and there's one more example that we wanted to cover with you.
Yes, ma'am. I had a question. Are we still going to have access to the county clinic?
Yes.
And do the visits there come off of any, do they apply towards any deductible or anything like that?
So the question is, are we still going to have access to the county health clinic? And do our visits there come out of our deductible? And the answer is yes, the county health clinic is still going to be available for our use, but no, any visit there does not hit your deductible and it does not hit your maximum out of pocket. It is fully funded by the county. The county health clinic is. Yes.
Have you run into scenarios on a catastrophic event, say like a heart surgery or an automobile accident where you have $200,000 or $300,000 worth of medical bills?
Well, I know that we have had some employees that have, been billed into the double-digit amounts for events such as what you just described. And what happened in those situations is out-of-network providers is what, who treated them. So an example I was gonna cover in a moment is an employee who had an $18,000 out-of-network care provider bill that they received. So it can happen. And once medical care reaches a certain level, it goes into something called stop loss, which is separate from our Aetna coverage. Yes. Okay, I wanted to just show y'all one more example, and this is an example of somebody who doesn't have any fees listed in their regular medical visits, because this person used the county health clinic. So there were no doctor visit and member rates to look at, and there were no copay amounts to look at. But there were some specialist visits, and the first one was, the Aetna member rate is $174 for the specialist, but the person actually paid $60, because this person is actually on the buy-up plan. So they actually paid $60. And then probably the second one here, there was some type of procedure conducted in the doctor's office, and it was $1,200. That was the Aetna member rate. But the person actually only paid $60 for that specialist office visit. Then there were a couple of medications. One of them, was pretty cheap, $3.93. Would have paid that on either plan. And then the other one was a generic. On the HRA plan, it would have been $761, but it was only $5 under the buy-up plan. And then this was another medication that was picked up. $1,255 is what the person would have paid on the HRA plan. However, on the buy-up plan, the person only paid $210. And what that amount encompasses is the pharmacy deductible on the buy-up plan, which is $150. And then this was a tier 3 drug, which is $60. So they paid the $210 for that medication. So under the HRA plan, total for the year, and again, this is with new premium amounts. Total for the year, the person would have been out of pocket $1,650 and some change. And under the buy-up plan, just under $1,600. So I just wanted to show y'all that example in a situation where a buy-up plan for somebody could be a little bit cheaper than going on the HRA plan. And just remember, a major difference between the two plans is that on the HRA plan, every time you go to the doctor, every time you pick up a medication, and then you have some sort of other medical event, that hits your deductible. These visits that this person had and these prescriptions that this person picked up, none of this hit the deductible. It did hit the maximum out of pocket. So the maximum out of pocket was reduced by $120 here and then by $218 here. So, a little over $300 out of the maximum out of pocket, but nothing was taken from the deductible. That's a huge difference between the two plans. So, you know, when you talk about major medical events, something major happening, you just have to decide for yourself, well, which way do I want to get there first? As far as paying your deductible and then paying your 20% for network care up to the maximum out of pocket. Okay. I believe this insurance worksheet was emailed out. It's also on the county T-Drive. T-Drive and HR forms for users, and then insurance worksheet, I think is what it's called on there. So here are ways that we can save money on our own health care. And the very first thing that we knew we had to talk about was the use of assistant surgeons. This actually happened to an employee. They had a surgery done, and they had an in-network doctor, they were using an in-network facility, and then they got a bill for $18,000 from an assistant surgeon who was out of network. And it's my understanding they didn't actually perform the surgery either while they were in the room. So in order to try to prevent this from happening to you, the best thing for you to do is to talk with your doctor prior to, if it's something that you are planning, and make sure that there are not going to be any out-of-network doctors who are going to be, or physician's assistants or nurse practitioners who are going to be assisting during the surgery. Ask for only in-network doctors if you're able to do that. And again, lab work done at the employee health clinic is the same as going to a doctor's office at the employee health clinic. It is free for the employees to use. The county funds that. If you're able to avoid ERs and standalone emergency rooms, if you're able to, if you're having chest pain and you're having difficulty breathing, take care of yourself, go to an ER, have somebody call 911. Take care of yourself. But an example is, let's say you have a sore throat and a slight fever, and you go to a standalone emergency room. You could be facing a bill of about $3,000, where had you gone to an urgent care, then you would only be paying $150 on the HRA plan or $50 on the buy-up plan. And again, the choice is yours, but it's just a fact that emergency rooms cost more than urgent cares, and emergency rooms definitely cost more than your doctor's offices. But if you need critical care immediately, utilize the emergency room. Also, something that is coming soon is something called Ready MD. And Ready MD is a telemedicine program. Our Commissioner's Court approved it last week or so, and we are in the process of getting all the specs worked out for it. So as soon as we have it ready to go, we are going to get the information out to y'all, and then we're going to have some more meetings to explain how to use it. And we're also going to put information out to y'all explaining how to use it. So what Ready MD is, again, it's a telemedicine. So let's say it's Christmas Eve or New Year's Eve and you're not feeling good and you really don't want to go to an emergency room, you can call you can make an appointment, call the Ready MD doctor, and they can talk with you over the phone, figure out what's going on with you, determine if you need a prescription. And they will call in a prescription to your pharmacist if that's what you're needing. Their normal business hours run from about 8 o'clock in the morning, and depending upon the time of year, could run until about 8 to 9 o'clock in the evening. If you're able to get an appointment with them during that time frame, then they'll do actual video conferencing with you on your smartphone, on your tablet, or on a computer that has webcam capability. And they'll actually see you and have a doctor's visit with you that way. They can see you for a lot of things that you can be seen for in your regular doctor's office. So if you're having that sore throat, if you have a fever, they might ask you to take your temperature and put into their online system what your temperature is, or just tell the doctor while you're on the phone. If you have a personal blood pressure, device, they might have you, they might have you take your blood pressure and let them know what that is. You can take pictures. If you have some sort of skin rash, you can take a picture and text it or email it to the doctor's office for them to look at. It is telemedicine. You do not have to go to the doctor's office to be treated. And this particular plan that the county is going to start utilizing is free to the employees to use. The county does pay a fee for the actual face-to-face contact. As soon as we get that off the ground and running, we will definitely get the information out to you. Do you have any questions about that? So another way to save money on your healthcare costs, if you're able to, shop around for your care. You can work with your doctor to see if there are other options for you to use to have those MRIs done at, to have your x-rays done at. Find the one that would be best on your pocketbook. I think Kristen talked a little bit about the sleep studies. There are different costs associated with where you have a sleep study completed at. So be sure to ask your doctor about your options. You can contact Aetna and ask Aetna what the different costs would be depending on where you have it completed at. The difference could be between using a facility close to us here and it be free to you, or going to a facility 10, 20 miles down the road and it being out of network and potentially costing you over $15,000 to use. So shop around for your care. And then Kristen also talked about the flexible spending account. A flexible spending account can be used in conjunction with the HRA plan or the buy-up plan. If you use the buy-up plan and you put some money in your flexible spending account, you can use your flexible spending account for your doctor's office visit copays, for your prescription copays, for your dental care, vision, and things of that nature. And then with your HRA plan, if you know that a typical year for you would be that you might spend a little bit over $1,000, put that extra amount on a flex card, it reduces your taxable income, and you slowly pay it out, like Kristen said, through payroll deductions over the year. It's just another way to save money. Do you have any questions about those things? Okay. Anytime you have a question about any of your benefits, healthcare benefits or otherwise, don't hesitate to contact someone in HR, and we'll help you figure out the answer to your question. That's all that I have as far as the county's presentation goes. We do have some vendors here who would like to discuss a little bit with you about their supplemental plans. And I guess first we'll have Barbara Meeks come up with Aflac.
I'm Barbara Meeks with Aflac. Are there some new employees in here this year that maybe we haven't talked to before? I think most of you have heard about Aflac. You know that we're the company, unlike health insurance that pays the doctor, the hospital, the lab. Who are we going to pay? We're going to pay you, aren't we? Yes, indeed. And some of you already know that. You had to kind of find out the hard way. Melissa gave some great examples up here on potential claims, medical issues, and guess what? Aflac can be there with you every step of the way, whether it's a step and you twist your ankle and you go to even the care here, they'll pay you because our contract is with you. You own the policy, it's fully portable, so if you're getting maybe close to retirement or you hit the jackpot and you decide, hey, guess what, I'm not going into work tomorrow, you can still keep your Aflac. You can set it up on a monthly bank draft, on a monthly credit card, or quarterly billing at home if you want to still do it the old-fashioned way and write out that check. We do have a new policy this year, and it's a little bit of an enhancement over the others. It's called Hospital Choice. Some of you might have our Hospital Advantage or Hospital Indemnity. And so each year, in order to try and keep up with the rapid rise in medical costs, Aflac will fine-tune their policy. Yes, it comes with a little tiny bit of a rate increase, but not that much. And one thing I want to point out, that the sleep study that she referenced earlier, even if it doesn't cost you anything, if you are able to take advantage of the great plans that the county has put together for you, if you have this plan, it will still pay you $150. Now that may not sound like a lot of money, but if you're getting something for nothing, then you could go shopping, or whatever you want to do with that. That's totally your decision. So you can use it for your medical expenses. Now, if you want to get the Aflac app, there's a number and it's on this rate sheet. It's in the blue information of page 2. You can text Barbara Meeks to 36260, and that will be a link to the app, get you more information, and keep in touch that way. Other than that, helping me today in the back is Rhonda and Saul, and we'll be more than glad to help you with your wellness benefits. If you have our accident policy or the cancer policy, maybe you have our short-term disability plan and we need to file your claim on that. Let us know what we can do to help you, okay? Thank you very much.
I'm gonna change gears on you. Hopefully all of you have one of these appointment requests, because I thought I heard a couple of questions about catastrophic illness. My name is Jimmy Wilson. I'm here with Right Way Imaging. We're a mobile ultrasound company. We're coming to you. We're bringing the specialist to you. You're gonna get to see a specialist at a fraction of the cost just because you're part of this program. We're going to offer 9 different tests. This should touch everybody in the room. Let me see. How many of you know somebody personally who suffered a heart attack or stroke? If you would, just shoot your hand up real quick. Just about everybody in the room. The reason I ask people to do that is real simply this. You're not going to remember everything I share in the next 5 minutes, but you will remember that you saw just about every hand go up. According to the Stroke Association, 80% of all strokes can be prevented. Stroke right now, with all of our technology, all of our technicians, all of our insurance, all of our doctors, is still the 4th largest killer in our country today. 2nd largest killer amongst women is stroke. The number 1 reason that people are admitted into a nursing home, which spends the best years of their life living in a nursing home, is dementia and stroke. This is a representation of your carotid artery. What we are looking for is represented there in yellow, which is fatty or hard plaque. This clogs the arteries, restricts blood flow to the brain, and quite simply, that's what a stroke is. Well, the best way to identify how much of that is in your carotid is by using ultrasound. In a local hospital, it could run you several $1,000s if you wrote a check yourself. Even though you have good insurance, you're still going to be out some money. But because we're a private company, we don't pay for a building, we only work with large groups, we are able to offer you these life-saving tests at a fraction of the cost, which I'll get to in a moment. We're also going to take a look at your thyroid for you. We're not looking to see if you need thyroid medication. We're going to look to see if you've got abnormalities, tumors, or cysts, which could possibly be cancers. It's not a cancer screening, but we do find these things. We are also going to look at your aorta. That's the main artery that comes off of your heart. We're going to check for aneurysm. Aneurysm is a ballooning effect of the artery or a weakness of the artery wall. When it bursts, it's 95% fatal. And most times this particular disease is misdiagnosed. So it's imperative that we identify these diseases before symptoms are present. You'll hear me say that several times, because we go to the doctor when we're sick, when we're hurting. This is the reverse thinking. This is getting to a specialist before the symptoms are present. We're also going to look at your liver, your kidneys, your gallbladder, and your spleen. We're going to do a 2-lead EKG checking for atrial fibrillation or irregular heartbeat, which is another cause of stroke. Now here's the great news. The total cost is $159. That includes the reading of a board-certified radiologist. Now, If this makes sense to you, now here's who really needs to be listening to what I'm saying. If you have high blood pressure, diabetes, high cholesterol, you're at a stronger risk percentile. But if you have family history of heart disease or stroke on either side of your family, I'm going to strongly urge you to take advantage of this opportunity. This is something you're not going to regret going down the road. Because what you've heard this morning is, catch it early, use that insurance, because what we're going to do is once we've identified there is a potential problem, you're going to get the actual thermal images that we take on site. You're going to take that to your physician, and then he or she is going to do the diagnosis. We're not going to send you to our doctors or to our clinics. We're just going to say, hey doc, here's something, those symptoms are present. What do you want to do? So now we put that good insurance to work before you're in an emergency room, before you're in ICU. So if you want to participate, I need you to, if all of you have one of these, if somebody doesn't have one that wants to participate, you have yours, you can have that one, okay? I need you to jot on there just your name and telephone number. I'm going to take those from you at the end of this meeting. All you're doing is exactly what it says on there, requesting an appointment. I have a whole bunch of these for you to take home with you for your significant other. Because here's the good news, whether they're on your insurance or not, they can have it done also for the 159. All we're doing today is getting appointment requests. We'll call you back. We have September 6th and 7th set aside for this area. Remember, our equipment comes indoors. It's the same technology, same technicians that the hospitals use. We just can do it at a fraction of the cost. So this lets you jumpstart your health insurance and take control of your health care and do it at a fraction of the cost. Now, are there any questions? And as I said, this is not the time to be silent, because somebody else is thinking of the same question that they're just afraid to ask. Any questions? Yes, sir.
Barbara, would that be considered part of wellness?
Absolutely.
In Aflac?
Yes, indeed.
Okay, yes. And here's the other good news. I'm glad he brought that up. Y'all can use your flex spending to pay the 159. You can use that as well. So yeah, man, I'm glad you said that, because you can use your flex spending as well. So you're covered all the way around. So let's use it. Let's take control of our healthcare. I was in the insurance industry for a long time, and I thought, you know what? Let me keep people out of the hospital if I possibly can, instead of taking care of them after they're there. Because that's what this is about. Keeping you out of the hospital if possible, and especially out of a nursing home if possible. That's it. Thank you, folks.
I'm Heather. I'm with First Financial. I have Kathy Trussell here with me. So just to let you guys know, if you want to talk about your AUL alternate plan, she will be here afterwards if y'all want to talk about that. Okay, so I'm just going to go briefly over the benefits that First Financial offers. We have the same benefits that we've offered here the past few years. They did mention a couple times the flexible spending account. These are pre-tax funds you can use towards your medical expenses, dental, vision, things like that. And the amount did go up this year to $2,600. So you're able to do $2,600 per year, and you are able to use that for yourself and dependents as well. And we also have in the little booklet, this booklet, the Flex app, you can check your balance and submit receipts. And then also the FSA store where you can buy, sunscreen, Band-Aids, things like that. We also have the dependent daycare account. You can do up to $5,000 to pay for daycare expenses. Again, it's $5,000 per year, pre-tax money. You do have to wait for that to come out of your check so you can use it. But we also have a debit card you can use for that as well. We're also offering the cancer policy again this year. There is a difference to that cancer policy. We are not offering 3 options. We had the basic plan and the enhanced plan. Now we have the enhanced plus plan. They all cover the same things. Each level higher is just going to pay more benefits. It also has the wellness benefit that on the basic plan, $60 The enhanced plan is $75 and the enhanced plus is $90. It's gonna come directly to you if you get some kind of, wellness, screening. So if you guys wanna look at rates on any of these, products, just come see me afterwards. We also offer the Humana Vision plan. There are a couple changes on that plan this year. The rates for the Humana Vision plan did decrease this year, so they're a little lower than they were the past few years. But there are some changes to the plan as well. For example, the material copays to pay for the glasses, it was $10. It is going up to $15 this year. The exam is still $10 with a dilation. The allowance is no longer $50 wholesale allowance. We are now the Humana plan is moving to $130 retail. It's going to be retail versus wholesale now, so $130 retail allowance for the frames. And your contact lens allowance that you can do in lieu of the glasses is also $130 versus $110 that it was last year. So it is $130 for the contact lens allowance. So that is the changes on the Humana Vision. We have, Humana also offers a disability plan, a 14-day or 30-day waiting period. But you do have those two options, which pays you a percentage of your salary if you have to be out for injury or illness. We have the Humana Term Life, which you can add additional life insurance on yourself, your spouse, or dependents up to 26 as well. So we do have, and that's all based off of your age. So again, if you want rates on that, just come see me afterwards. Humana also offers an accident policy, which pays you if you have an accident, and it's off the job, which can cover you, dependents, and spouse as well, or the entire family. And we also offer the standard spouse life, which can cover your spouse life insurance. You can add life insurance on your spouse up to $150,000 at some pretty great rates. So if you guys want premiums on that, just come see me afterwards on that as well. That is all that I have for you guys. So if y'all have any questions for me, just come see me afterwards. Or again, if you want to talk about your AUL alternate plan, come see Kathy afterwards.
All right, I'm not going to complicate a one-way rock fight, but I hope you know that you have great insurance. You have a team of HR people that are working very hard. If you haven't been in corporate America for a little while, my insurance is a whole lot more and it pays a whole lot less. And so you do have great people working hard for you. Also, what they're offering you, how many of you have children, grandchildren that are fairly small that you would like to get off your payroll at some point? I have a daughter at Texas A&M, very proud, Giggle Maggies. If you're, UT, I'm sorry, but she's an Aggie, and Aggies are expensive, and UT people are expensive. She cost me to the tune of about $22,000 a year for tuition and books, and just a little apartment to live in. If she wants a social life, that is on her. She has to have a job to do that. But if you have, how old is your child? 3 years old. Do you have any clue what that might cost? If you were here last year, don't say anything. A year? At 4-year degree, 3-year-old will cost somewhere around $175,000 at a public school in state. If they are going to Rice University, God bless you, because that will cost you about $400,000 for a private university. It is something that is very expensive. What the county is offering you is an employee-sponsored 529 plan. It's a college education savings plan where you can put back money for college education, and it waives typically that upfront sales fee. So that's a 5.75% savings that you get right off the bat for being a county employee. They're doing this for you because they understand the importance of educating our next generation. And so if you're interested in that, or just anything in general, I'm Bill Fonder with Edward Jones. My office is about 2 blocks that way. But we help people plan. You talked about planning for your health care, planning a lot of things. Are you planning for your financial future and your kids' education? So if I can help out, please see me back there. If you want more information, I have a sign-up sheet, and I will be sure to get that to you. I think we have Costco.
Yeah, I was just gonna let y'all know too that we do have Costco here, and if y'all are interested in their product, then y'all can meet with their representative back here in the back, my left, y'all's right-hand corner. We are about to break so that we can get busy because there are a lot of y'all in here that we need to get through today. Again, over here to see Heather and Kathy if you want to make changes to AUL or Humana, flexible spending. If you have questions regarding any of Aetna's products, y'all can see Aaron, who's in the Giggle Aetna cap. And come see us at HR so